This presentation is to discuss linkage to care in rural Oregon for hepatitis C treatment and management, presented by Jess Freeman. My partner, Teresa Pinch, will conduct a live question and answer session following this presentation. We are both nurse case managers for Aviva Health. Aviva Health has 5 clinics throughout Douglas County, including Glide, Myrtle Creek, North County, located in Drain, Roseburg, and Sutherland. Currently, Aviva Health has 10 family medicine faculty providers, 23 resident providers, 2 nurse practitioners, and 1 physician's associate. The Aviva Health Nurse-Led Hepatitis C Treatment and Management Program was created in August of 2023. Since that time, we have increased the number of hepatitis C treatment prescriptions from 16 in 2022 to 30 in 2023 to 37 since the beginning of 2024, and we are still actively prescribing for the year. Aviva Health became aware of the hepatitis C epidemic in Douglas County in August of 2023 when our public health walk-in clinic nurse saw an increase in positive hepatitis C cases. Our public health walk-in clinic nurse began bringing these patients with positive cases to the RN case management department to contact and address treatment steps. At the time, most of our providers were referring these patients to specialty clinics in Roseburg, Eugene, or Portland. Many of these patients were being lost to follow-up due to barriers in traveling to these specialty clinics. Teresa began researching hepatitis C treatment options and found specialists to meet with, including the Oregon Echo education series on hepatitis C treatment and elimination. This is when Aviva Health RN case management learned that patients with hepatitis C without cirrhosis can be treated by primary care providers, thus unloading some of the burden to specialty clinics and removing this specific barrier for patients. Aviva Health RN case management was also made aware of the AASLD and IDSA simplified treatment guidelines for patients without cirrhosis. The American Association for the Study of Liver Diseases, in collaboration with the Infectious Diseases Society of America, created the simplified hepatitis C treatment algorithm for treatment-naive adults without cirrhosis. This algorithm outlines eligibility requirements via pre-treatment assessments, the recommended treatment regimens, treatment monitoring, post-treatment assessment of cure via a sustained virologic response, or SVR, and various follow-up protocols based on achieving or failing SVR. This algorithm acted as a pillar for the Aviva Health Hepatitis C Treatment and Management Program to be built on. After speaking with hepatologists and enrolling in the Oregon Echo Education Series, the Aviva Health Hepatitis C Management and Treatment Procedure was created, followed by an order set to assist providers and resident providers in treating patients with hepatitis C without cirrhosis. Today, Aviva Health is aware of 236 patients with active hepatitis C or a history of hepatitis C. RN case management follows patients being treated by our providers as well as patients being treated by specialty providers. We are tracking patients who have a positive viral load, are waiting on pre-treatment labs and imaging, patients waiting for their medications to be delivered, patients who are currently taking their medication, patients who are waiting for their SVR labs, patients who have been cured, as well as patients we have been unable to contact or patients that have declined treatment at this time. The Aviva Health Hepatitis C procedure outlines the responsibilities of the RN case managers as well as the primary care providers. This procedure describes the patient trackers utilized by the RN case managers, the laboratory tests and imaging required before, during, and after treatment, the treatment process, and the follow-up process once treatment is complete. Aviva Health uses the following pathways to identify patients who are positive for hepatitis C, including previously diagnosed patients with an active hepatitis C diagnosis on their problems list, quality improvement screening focused on once-in-a-lifetime or annual screening based on risk factors, Medicare annual wellness visits or public health walk-in clinic, our reproductive health department, including all pregnant patients at each pregnancy, our medication-assisted therapy clinic, or verbal reports from patients. Once patients have been identified as having a positive hepatitis C viral load, patients must have a documented discussion with a provider about their hepatitis C diagnosis. Since creating this program, Aviva Health has seen both in-person and telehealth visits be accepted by insurance. After this discussion with their provider, patients can begin pre-treatment labs and imaging identified in the hepatitis C order set. Aviva Health RN case managers are responsible for notifying the Douglas County Health Department of the positive communicable disease result. The order set used by Aviva Health includes 15 labs and a referral to case management. In order of appearance, we have the hepatitis C viral load and genotype, an HIV viral load, a CBC and CMP, a fibrometer virus, which is the blood test for a FibroScan. This is one measure of liver health identifying the level of scarring. A hepatitis A antibody, a pregnancy test to be administered for all persons with a uterus of childbearing age without a history of tubal ligation or hysterectomy. Then we have a triple panel hepatitis B labs, including the hepatitis B surface antigen, the hepatitis B surface antibody, and the hepatitis B virus core. If the hepatitis A antibody or hepatitis B antibody result as negative, then the patient will be offered a hepatitis A and hepatitis B vaccine. The CDC recommends patients without immunity to hepatitis B receive their hepatitis B vaccine. However, the initiation of hepatitis B vaccines should not delay treatment for hepatitis C. Our final labs are the INR and an iron, TIBC, and ferritin to also evaluate liver health, along with an RPR to test for syphilis. Lastly, we require a limited abdomen ultrasound to assess for fibrosis and cirrhosis. The hepatitis C referral is used by the RN case managers to track patients enrolled in the program. As mentioned earlier, the RN case managers are responsible for maintaining an accurate patient tracker to identify patients who are waiting on pretreatment labs and imaging, patients waiting for their medication to be delivered, patients who are currently taking their medication, patients who are waiting for their SVR labs, patients who have been cured, and those being managed by specialty clinics. To receive treatment through the Aviva Health Hepatitis C Treatment Management Program, patients must meet our eligibility requirements. First and foremost, the patient cannot be pregnant as there is currently no FDA-approved treatment for hepatitis C in pregnancy. Our other requirements include no co-infections of hepatitis A, hepatitis B, or HIV. Patients must have a fibrometer result less than an F4 and be hepatitis C treatment naive. If these requirements are not met, Aviva Health will refer these patients to a specialty provider, including but not limited to gastroenterology, infectious disease, the OHSU PATH program, or OHSU hepatology. Current treatment medications utilized by Aviva Health include Mavyret, Epclusa, and their generic formulas. RN case managers review patient insurance, discuss with the prescribing provider, then speak with the patient about medication options. The decision for which medication to prescribe is primarily dependent on insurance. However, most insurances cover multiple options. The RN case managers will connect with the prescribing provider to determine if they have a preference, and if they do not, the nurses will then discuss treatment options with the patient. Patient-specific choices revolve around multiple factors, including the timeline of medications being either 8 or 12 weeks, and the patient's perceived compliance capability of these timelines, as well as the amount of pills taken a day. For example, we have spoken with a patient who preferred the 12-week treatment due to believing she was incapable of taking 3 pills at one time every day. We have also had patients who preferred the shorter timeline of 8 weeks. Another factor includes the patient's swallowing capability, as some of our patients have difficulty swallowing multiple tabs in a short time frame. The third factor focuses on behavioral health comorbidities, which was a discussion the provider, nurses, and a patient's caregiver had, as the patient was hyper-focused on the number of pills she took a day, thus making it difficult to include a short-term medication. It was brainstormed to have the patient change one of her antipsychotics to an injectable for the duration of the hepatitis C treatment, thus replacing the antipsychotic tablet with the hepatitis C tablet. Unfortunately, this patient was lost to follow-up before this method of treatment could be implemented. By having these discussions and knowing which medication insurance will cover, patients can be empowered to choose their preferred hepatitis C treatment regimen. One of the biggest barriers Aviva Health has faced with hepatitis C treatment is learning and staying current with which specialty pharmacy insurance requires the hepatitis C medication be dispensed through. For the large majority of patients in Douglas County, hepatitis C treatment must be obtained through a specialty pharmacy. RN case managers are consistently updating a running list of common insurances and the treatments they will cover, including the specialty pharmacy they are using. This list changes at least once a month, if not more frequently. Regardless of which specialty pharmacy is used, additional paperwork is required alongside the prescription. That paperwork includes the patient's demographics, including their height, weight, and street address for delivery, the patient's insurance information, their current medication list, the last office note within 90 days discussing the patient's hepatitis C diagnosis, and results from the patient's pre-treatment labs and imaging. Once the specialty pharmacy receives the required paperwork and prescription, the medication will be ran through insurance and a prior authorization will be created. Once the specialty pharmacy has received approval from insurance, the specialty pharmacy will contact the patient to confirm information and schedule delivery. Another frequent barrier our patients in Douglas County face are high copays with Medicare paired with decreasing patient assistance funds available through foundations and drug companies. RN case managers are also responsible for assessing any drug-to-drug interactions with the hepatitis C treatment. The main interactions with hepatitis C treatment medications are statins, acid-reducing agents and proton pump inhibitors, amiodarone, birth control preparations, rifampin, and herbs. The most commonly used resource by Aviva Health is the Liverpool HEP Drug Interactions Checker. The RN case managers have identified the following goals for hepatitis C treatment and management through Aviva Health. We educate, encourage, and monitor patient adherence to their chosen treatment regimen. We assist in mitigating barriers to treatment. We provide support and education to both our patients and our providers. We encourage patient compliance with lab work and imaging via telephone and electronic medical record portal reminder messages, as well as attempting to prevent treatment interruption or delay, for example, a change of insurance in the middle of treatment. Once treatment has been initiated, we require 2 sets of labs. The first is done 4 weeks after the initiation of treatment, includes a CBC and CMP. This has been implemented due to prior therapies involving case reports of acute kidney injury, or AKI. RN case managers complete thorough education with these patients, informing them that so far, AKI has not been seen with Mavra or Epclusa. Many times our patients are appreciative of the transparency and continued monitoring of their organ health. The second set of labs required is to be drawn at least 12 weeks after completing treatment. These labs consist of a CBC and CMP to again check organ function, and most importantly, hepatitis C viral load to assess for a cure. We have had patients who have been lost to follow-up, and we have drawn these labs weeks to months after completing treatment. As long as the SVR is drawn 12 weeks after the patient's last dose, it is a valid result. Aviva Health has identified the following risk factors to prompt an annual hepatitis C RNA lab, regardless of infection or treatment status. These risk factors include the handling of inanimate surfaces, such as cookers, filters, syringes, needles, and other illicit drug paraphernalia. Known direct contact with persons diagnosed with an active hepatitis C infection, all forms of illicit drug use, which has recently been updated to include more than just injection drug use due to the length of time the hepatitis C virus can survive in organic materials such as crystals. Other risk factors include men who have sex with men, patients receiving dialysis, patients who have received a blood transfusion prior to 1990, patients who have received a tattoo or piercing from an unlicensed artist or location, and occupational needle sticks. Although not a risk factor, any patient who asks for a hepatitis C screening shall be screened. One of the most important pieces of surveillance is when cirrhosis is suspected or confirmed in a patient. Anyone with a diagnosis of cirrhosis or suspected cirrhosis is recommended to get a liver ultrasound every 6 months for the rest of their life to screen for hepatocellular carcinoma per the CDC. Other considerations Aviva Health implements for our patients receiving hepatitis C treatment include patients on Coumadin, as we must monitor for subtherapeutic INR results during hepatitis C treatment. Patients with diabetes must be monitored for hypoglycemia. Patients who take the entire treatment regimen as directed and do not achieve a cure have failed treatment. Following a treatment failure, Aviva Health will assess the patient's CBC, hepatic function panel, and INR every 6 to 12 months until retreatment by a specialist occurs. Patients who have treatment and spontaneously stop treatment will have a hepatitis C RNA lab drawn 12 weeks after their last dose. If SVR is achieved, the patient is considered cured. If SVR is not achieved, the patient will be referred to a specialist for retreatment. If a patient declines treatment, their primary care provider will readdress treatment options with them annually. Because Aviva Health has both family medicine and pediatric providers, we have included the newest CDC guidelines for children with hepatitis C and perinatal exposures. A hepatitis C infection resulting from a perinatal exposure is labeled as a vertical transmission. The updated CDC guidelines include new screening recommendations for testing for a hepatitis C viral load as early as 2 months. If a child tests negative for a viral load between 2 to 6 months, no further testing or follow-up is needed. Just like adults, children can spontaneously clear a hepatitis C infection. The highest rate of clearance in children occurs before the age of 3. If a patient tested between 2 to 6 months of age shows a positive viral load, the patient will again be tested for an active infection at 3 years old. The FDA currently recognizes treatment for people ages 3 and up, though a pediatric gastroenterology pharmacist should be involved if treatment is to be initiated. Additionally, the CDC recommends not antibody testing a child under 18 months, as the child will retain hepatitis C antibodies from their birthing parent. So far, Aviva Health has seen one vertical transmission of hepatitis C, which we were able to successfully treat. We also recently tested for an active viral load in a 9-month-old whose mother had a known infection of hepatitis C. This child tested negative and required no further follow-up at this time. The last topic we wanted to highlight in this presentation is resources that were vital to the creation and implementation of the Aviva Health Hepatitis C Treatment and Management Program. Our first introduction to the education of hepatitis C treatment and elimination came from the Oregon Echo Connect Treatment and Elimination Education Series. This program is built to empower and support healthcare professionals to effectively treat patients with hepatitis C by using video conferencing to connect interdisciplinary teams of specialists and subject matter experts weekly for 16 sessions. These sessions include a didactic presentation from experts and time for participants to present current hepatitis C cases to receive real-time feedback from the ECHO faculty. Once the 16-week course is complete, Oregon Echo offers a once-a-month community of practice meeting to stay connected with specialists. This course was instrumental in providing the necessary background information and treatment recommendations to begin building a primary care hepatitis C treatment and management program. OHSU offers a daily provider consult line monitored by hepatology faculty from 0700 to 1900. The hepatology faculty provider associated with the ECHO series we attended is Dr. Arnab Mitra. The provider consult line is 503-494-4567. If an insurance is requesting the patient see a specialist prior to receiving hepatitis C treatment, Aviva Health has seen success in informing the insurance company that the provider team has consulted with specialists, thus removing the requirement of a patient needing to physically see a specialist before treatment can be obtained. Next is the Empire Liver Foundation, based in New York, who offers a year-round 4-session educational series. The series is presented live twice a year. However, the most recent recordings and slides are available anytime. The Empire Liver Foundation also offers more specialized training once the initial series has been completed. Lastly, we want to recognize the Oregon Viral Hepatitis Collective, which has connected us with numerous invaluable resources. Teresa and I have begun presenting our hepatitis C treatment and management program to other clinics and counties throughout the state of Oregon. This is a pared-down version of what we present, but our goal has remained the same: to increase the ease and linkage of care for patients living with hepatitis C throughout Oregon. While we have big dreams for our clinic, we are currently limited to treating Aviva Health patients only. By sharing our program with other primary care providers, we hope to act as an example of how straightforward hepatitis C treatment can be for patients without cirrhosis. Please feel free to reach out to us with any questions, concerns, or a desire to have a continued conversation about increasing linkage to care for hepatitis C treatment in the setting of primary care. Thank you for your time, attention, and your commitment to eliminating hepatitis C in Oregon.